So we're going to be studying right ventricular hypertrophy, which is one of the topics in ECG basics. So it's going to be an easy ride. So normally in the heart, the left ventricle has a larger chamber, is larger than the right ventricle. So as a result of this, the left ventricle has a more electrical dominance. Now, the normal axis of the heart actually is minus 30 degrees to plus 90 degrees. So it's going to be around this area. That's for the axis. But then in right ventricular hypertrophy, due to the enlargement of the right ventricle, please note that this is the right ventricle. This is the right ventricle. This is the left ventricle. Right atrium. This is the left atrium. So, due to the enlargement of the right ventricle, the electrical dominance changes. So we now have the electrical dominance being exhibited by the right ventricle. You see, this is just an image showing the enlargement. So the electrical dominance now moves the axis from this side to around this side. Are you getting me? So when you are doing the axis and you are getting plus 110 or more, that's more of right axis deviation. So which is because, let me clean this, which is because of the hypertrophy on the right. So the left ventricle that used to be electrical dominant side, now it is the right ventricle, this side, that is exhibiting the electrical dominance because of the enlargement. So what you now see is a right axis deviation. And so one of the features is a right axis deviation of at least of 110 degree or more, of plus 110 degree or more. That's one of the features. Then another thing we tend to see is the R wave progression. As you actually move from the from V1 to V6, ideally as as you move from V1 to V6, the R wave should progressively increase. As you move from V1 to V5, the R wave should increase. That's in a normal heart. But then when you are having right ventricular hypertrophy, now the basis of that progression is just saying that as you are moving like this, that's a normal this thing. Are you getting me? Normally, the wave of depolarization spreads in this direction. I'm coming. I want to make it clearer. So as you are moving, normally as you are moving as the wave is going like this, is the wave of that's the way the wave of depolarization goes. So normally the R wave progression should increase from V1 to V5. But then in a case of right ventricular hypertrophy, that scenario is reversed. Instead, V1 actually lies over the right ventricle. So what we now see is let's say this V1, V2, V3, V4, V5. R wave should be increasing, like it should be increasing. Like what I'm trying to say is, As you move from V1 to V5, the amplitude of the R wave should increase normally. But in right ventricular hypertrophy, we have a reverse of that. So what you now see is the R wave decreases as you move from V1 to V5. Why is this so? The right ventricle is hypertrophied. So it means that the lead, which is above it, which is V1, we actually have the highest amplitude. Are you getting me? So instead of the R wave amplitude increasing as you move to the left, the reverse is what occurs. And in this case, you see a large R wave in V1, which lies over the hypertrophied right ventricle. And then you are now seeing a small R wave in leads V1 and V6, which lies over the normal but electrically humble, yes, I'll use the word electrically humble left ventricle. So if you are seeing that with the R wave, it means that you should be seeing an inverse of it for the S wave, which means that for V1, the S wave will be increasing as you move from V1 to V5. Let me put it in writing. In RVH, R wave decreases as you move from V1 to V5. The S wave increases, yes, as you move from V1. So as you move from V1 to V5. So now let me state out the features or the things you see, that with that you can make that these are the things you expect from right ventricular hypertrophy. So in right ventricular hypertrophy, we have a right axis deviation of plus 110 degree or more. Yes, then in V1, which is V1 here, the R to S ratio is greater than 1. Sorry. The R to S ratio is greater than 1. Then secondly is that or the R wave is greater than or the R wave is greater than 7 mm tall. Are you getting me? This is in V1. Then in V6, the RS ratio is less than 1, or the S wave is greater than 7 mm deep. Normally in V1, RS ratio should be less than 1. But when you are seeing RS ratio of greater than 1 in V1, or the R wave is greater than 7 mm tall, that is suggestive of right ventricular hypertrophy. And for V6, RS ratio, normally it should be greater than 1. But when you are seeing it less than 1, or S wave is more than 7 mm deep, these features are suggestive of right ventricular hypertrophy. In addition to another thing you might see is when you're also seeing features of right atrial enlargement, so that supports the diagnosis of right ventricular hypertrophy. So before I end this, I'll just talk of few of some causes. So causes, as you have pulmonary hypertension, pulmonary embolism. Anything that happens to put a strain on the right side of the heart will cause a right ventricular hypertrophy. Chronic lung diseases, pulmonary stenosis. So I think with this you should be able to identify features of right ventricular hypertrophy on ECG. So it's easy as that. ECG comes with practice, and I can promise you that you can be that guru in ECG.